following preoperative occlusal view of a pre-existing defective amalgam restoration with recurrent decay. A shade was selected prior to rubber dam placement to prevent improper shade matching due to dehydration. The preparation for composite required removal of the previous restoration and carries, keeping all the line angles rounded without any retentive angles. No bevel should be placed on the occlusal. Composite placed on the occlusal bevels has a greater tendency to fracture because of its thin dimension and lack of strength. The preparation is cleaned with a disinfectant to remove all visible contaminants. A mixture of pumice and disinfectant can be used for extra cleansing power. The preparation is then rinsed and lightly air-dried. The total etch technique was used to minimize the potential of micro-leakage and enhance bond strength to dentin and enamel. The preparation was etched for 15 seconds with a 37.5% phosphoric acid gel etchant, rinsed for 5 seconds, and gently air-dried for 5 seconds. The etch should extend several millimeters beyond the margin. When the enamel is completely covered, apply to the dentin and leave for 15 seconds. A disposable brush can be used to agitate the etchant. The etch is rinsed off for 5 seconds. If a residual etchant is still present, additional rinsing is necessary. A single component adhesive, OptiBond Solo Plus, was applied with a disposable applicator for 15 seconds with a continuous motion. The adhesive was lightly air-dried for 3 seconds. Then the adhesive was light cured for 20 seconds with an Optilux 501 curing light. The first occlusal increment, an A2 shaded hybrid composite 0.4, was placed against the buccal wall, not crossing the preparation buccolingually. The increments should follow the cuspal inclines. These measures minimize polymerization shrinkage, preventing contraction of the cusp, which can lead to postoperative sensitivity. The final layer was a T1 shaded hybrid composite 0.4. An invagination is placed in the final composite increment, and an infinitesimal amount of ochre tint, Color Plus, was placed in the region with an endodontic file. Then the invagination was closed by pushing the peripheral regions of the final layer together. The anatomical morphology was accentuated with an egg-shaped fluted finishing burr, a 9406 blue-white carbide finishing burr, and the occlusion was inspected. Polishing was completed with rubber points. The margins of the restoration were re-etched with a 37.5% phosphoric acid gel etch, and a composite surface sealant was applied with a brush, lightly air-thinned, and cured for 20 seconds. This surface sealant has been shown to increase wear resistance on posterior composite restorations by sealing any cracks that may have formed during the finishing procedures. A before and after occlusal photograph comparing the lifelike restorations that can be created by utilizing the stratification process in this universal system.